That'll do. Yeah. Okay, we're recording now. So, hi, Jackie Clarke.
Hi, Avril.
Thanks for meeting me on Zoom today. Jackie, do you want to start off by telling my clients, mostly I imagine, about what you do for a living? Because it's quite unusual, I think.
Right. Well, there's two parts to what I do. My company's called Infrared Technology, and that involves laser therapy, which is therapy for injuries, not just injuries, but for degenerative diseases like arthritis, etc. And that's all done with infrared and red laser light, and that's a healing process. But we also do thermal imaging. So with a thermal image camera, we can identify sore areas. We only do the thermal imaging on horses, and occasionally I will do a dog, but it has to be a short-haired dog to get an effective result. So it's twofold, really. The infrared technology site is based on the thermography, gives us an indication of where an injury is. For example, if I have somebody that rings me and says, well, my horse is intermittently lame, but nobody seems to know where it's coming from, we can scan a horse and identify the area where the inflammation is, and take it from there. And then, you know, anything serious is referred to a vet, and often we can treat with laser therapy. Obviously, any of the modalities, they are only an aid to diagnosis. They should never be taken as instead of a vet. There's something to use in conjunction with veterinary care.
And I know for me personally, I've used your both the thermal imaging on my horse, and certainly the laser treatment on my horse, my dog, and me. So I've personally experienced the amazing healing power of the light therapy. I don't know if you can explain a little bit how it works, because I don't really understand it. I just know that it really helped me, and I saw a big change in my animals.
Okay, well, the laser therapy is very similar in a way to photosynthesis. Our bodies react to light. We all know we feel better when we go out in the sunshine. So the laser therapy is red and infrared. Both of those are two different types of light, and they come in different wavelengths, and they're pulsed in different ways. It would take me hours to get into the nitty-gritty of the different types of pulsing. But the cells in our body all uptake light. And basically, if we have an injury, or we have, say, arthritis, and that is probably one of the biggest things I use the laser therapy for in humans, dogs and horses, the cells have to work to try and heal the area. And with something like arthritis, it wears the cells out, and the cells don't regenerate themselves quickly enough, because in our bodies, the cells are regenerating over and over and over and over again. And when they effectively get tired, that's when we start having chronic problems. And our body then can't get rid of the inflammation, and we're stuck with something for a long period of time, sometimes forever. So what the laser does is it effectively regenerates the cells, because once you place the lasers onto the part of the body that you're trying to rectify, the cells uptake that light, and it gives the cells more energy, which then allow the body to heal itself naturally. It's quite a simple process, and it can only really be likened to photosynthesis, because we absorb light.
And it's fairly non-invasive as well, isn't it? I certainly know for myself, apart from maybe having to roll my trousers up for you to access a bit of my leg. Do you know what I mean? It's not like you got to strip right off or anything, is it? You just got to expose a bit of flesh to where you want it treated.
I mean, it's totally non-invasive, which is the nice thing for it. Some horses, if they have bad backs, don't like being massaged. Some people don't like So that is a way, you know, through that. Lots of dogs, what we find with a lot of dogs that have arthritis, if they start to have various medication from vets, they then have to take into consideration age and everything else. And it's quite a nice way to actually treat an animal without any stress for them, because obviously we're mobile. We go to the stables, the home of the owners, and 99% of animals, and they're the best, I suppose, examples, because humans have all sorts of psychological issues where they can think they're hurting or not, but animals, it's as plain as day. You know, if you treat them, they either get better or they don't. 9% of animals absolutely love it. The first time, sometimes they can be a little bit, what's going on, but there's no pain. And once within 5 or 10 minutes of being treated, they usually go to sleep. People are a little bit more worried, I suppose. Will it hurt? Won't it hurt? It doesn't hurt. Occasionally after a treatment, after a first treatment, if the injury is quite severe, you might ache slightly afterwards. It doesn't make the condition worse, but it sometimes aches. And that's predominantly in men, and that's not because they're wusses, it's because their muscle fibres are slightly different. I don't usually tell them that. I usually like to let them think they're wusses, but it's quite rare. It's not a big percentage. But once they've had the first treatment, you know, the uptake of the light is usually really good, and 2 times 3 treatments suffice.
And how far apart would they be given generally, Jackie?
It's important to have 2 because one is what we call the re-inflammation phase, and that basically wakes the area up. So you're setting yourself up for the cells to absorb. So at that time, people often say to me, "Oh, I can feel heat." Well, that's the heat that the body is making. It's not the laser, because it's cold laser. So the second one would be a week later, no more than 7-8 days later, and that starts the recovery process. Depending on the injury, sometimes 2 treatments are enough. If you need any more, it would be 10 days, then 2 weeks. I stretch out the level, because we need the body to maintain and keep itself healthy and pain-free. So each time, I mean, a typical example would be a cruciate ligament in a dog. If I do a cruciate ligament in a dog, that's quite a long process. So, because that's quite a severe injury. So they would have 1 the first week, 1 the second, possibly 1 a week, depending on how severe it is, 1 a week for 4 weeks. And then after that, 10 days, 2 weeks, 3 weeks, until the dog is managing to support itself and we know the injury has repaired. That's probably the worst case scenario. With arthritis, in everybody that I treat, animals and humans, normally 2 sessions are enough, and then they tend to come back to me for 1 session, and it's usually when the weather changes. And that's not just when it gets cold and damp, it's when it gets hot, it's when it gets cold, it's any atmospheric change sets the arthritis off, and then usually 1 treatment's enough. So with a dog, for example, that's got quite bad arthritis, I mean, your Pie is quite a good example. When they have arthritic hips, arthritis in the back, I find that once they've had some laser sessions, usually it does depend on what they do. If you're going to let your dog go out as an elderly dog and it's stupid, then you're going to need more treatments. But most elderly, you know, resolve themselves to not being too silly until they see a squirrel. But I would say probably 5 treatments a year will maintain the arthritis. And the amount of people whose dogs and horses I've treated, that they managed to stay off medication as long as they possibly could, which really is always a bonus, I think, but that's obviously my personal opinion. So Yeah, I mean, the majority of time, most people have 2, maybe 3 treatments, which sets them up. And it's fantastic for wound healing as well, because it allows the wound to proliferate from the inside. So you don't just get a healing on the top of the wound, it penetrates lower and builds the tissue back up.
So what sort of wounds would you use it for, Jackie? Because I'm not so familiar. For me, I mean, I've used it more on the arthritis lines for me and the animals. So what happens with a wound? How does that differ?
I had a horse that was kicked, and he was kicked from his coronet band going up through his pastern. It was quite a severe kick, and the blood, when I got him in from the field, the blood was spurting out probably 6 inches. So I rang the vet, and they said, well, we'll get on our way to you. So I covered the laser in cling film so we didn't get any cross infection, and I managed to stop the bleeding with the laser. When the vet arrived, he looked at it and basically said, I can't stitch it because there isn't enough skin there to stitch. So I lasered it. I lasered it every day because I can. And it healed, and it was fairly well healed by 5 to 6 days. And wounds that won't heal, a horse that went up, and it was somebody that you would actually know, went up in a field, came down on a step on the side of the lorry and ripped his shoulder open. So we lasered it immediately. Again, a problem with not being able to stitch it because it wasn't a sliced wound, it was a complete gouge. And I lasered that. That had probably 4 lasers. Wounds tend to need more lasering. Ordinary sort of degenerative things like arthritis, because of the nature of how wounds heal. But it's quite important that I've dealt with wounds that people have said, we've had this wound for 9 months, it won't heal. Because what happens is sometimes the body will heal the top of the wound, and if the tissue hasn't proliferated up, it will just keep opening up. So we can use it very successfully on healing wounds that are difficult to heal. I have in the past also treated ulcers on people's legs, and that is quite constructive, and does help with the healing process. But the wound, I would say that the wound is probably the least part of my business, because most people with a wound, 9 times out of 10, you can actually suture it and tidy it up that way. But the nice thing, if you have a wound that has been stitched, if you have laser, it actually stops the scar tissue from forming. So you then don't have restriction in the tissue when it's healed. So that's a very important part, to heal a wound after it's surgically been, repaired.
That would be fabulous for humans as well then, wouldn't it? For scarring.
So I had a lady came off her horse on a menage and hit the fence, and it split her arm from the elbow to her wrist. It was stitched, and within 4 days we were treating it, and you would not know there was a scar there. And that was 2 years ago, and it's taken the scar away. There's no bump. But that's important to deal with that fairly soon after the injury. I mean, I've had people come to me sort of, I've had this, scar tissue here for 5 years. Well, that won't help it.
No. Okay. So this whole light therapy thing, which is that's about the best way I could describe it. I mean, it seems amazing to me about how somebody ever discovered it in the first place, to find out that this did work for arthritis and wounds and general injuries. Do you know anything about the history? Can you tell us anything about that, Jackie?
I think it basically stems back to scientists looking at photosynthesis. We know that we do all improve with sunlight. Plants absorb sunlight to make it grow, so the technology behind it is based on actual biology, insofar as they're reproducing a natural area, but by doing it via the laser, they can actually, you know, if we've got a sore elbow and we've got long sleeves on, our elbow is not going to absorb as much sunshine as if I put a laser machine on it. Effectively, what they've done, if you look back over the years, is they've just taken a bog standard theory that light and sunshine and our bodies heal and grow in that way, and put it into a machine. There's been a lot of research because they've been around for quite a long time. I mean, I've been doing this now 16 years, which is, I don't know where the time's gone, but they have improved over the years. And realistically, I would say it's probably only about 20 years since they've used this type of modality on animals. It was predominantly used in dentistry, chiropody, some physiotherapy, and then, like a lot of things with animals, we either with veterinary work, we either seem to be far superior to the treatment humans can get, or way behind what humans can get. So this was one thing that was behind, and it's an alternative therapy, and alternative therapies are always probably slightly less received up until recently. I think now everyone's open to trying something different.
Yeah, I'd agree. I think people are much more open-minded and willing to try things now, aren't they?
Yeah.
And I think so what sort of area do you work in, Jackie, in terms of, like, I appreciate at the moment on lockdown you're not doing much visiting, but generally speaking, what is your area of Essex? Or if it is just Essex, is it, maybe it's further afield? I'm not sure really.
I would say the majority of the time it's Essex, and I mean the entire part of Essex. I do go into Suffolk, but what I try and do is, if I go into Suffolk, I will go and maybe do 3 or 4, a mixture of people, horses, dogs. I mean, I'll happily travel. I do have a client in Windsor who I go to probably 4 times a year, but I'm always aware that obviously if I'm traveling, I will have to charge travel. So it then becomes, you know, a little bit more expensive for people if they're on their own. But if I can tie it in with others as well, I'm quite happy to go further afield. I do tend to go further afield with my thermal imaging because both of the things that I do are quite unique. There aren't many of us out there that actually do it. So I do tend to travel a lot more for the thermal imaging. And it depends really. I'm quite open. Always discuss with somebody, you know, when I can get there and what I can do.
So how would people get in touch with you if they'd like to find out about booking a session, Jackie? What would be the best way of contacting you?
On Facebook, and my website is www.infrared-technology.co.uk, and they can contact me through any of those modalities. And once they go onto Facebook or my website, it's got my email address, my phone number. There's a link on the website if you want to ask questions. So quite easy to contact.
And my thought would be, when I put this up on YouTube and we link it to Facebook, we could put in the comments, we could put the links to your website and your contact info, so people could just click on the links and go straight there if they'd want to.
I mean, I work with my daughter, and she does equine massage as well, and the laser. I personally don't do any of the massaging. I just do the thermal imaging and the laser therapy. So there's always one of us that is about to take on any laser work.
Brilliant. And are you seeing any clients at all at the minute under lockdown, or is it just emergencies only?
Just emergencies. I've had a couple of emergencies recently, but they're people that I know and in their own yard. I can't travel into lockdown yards. It wouldn't be correct.
Mm-hmm. Oh, that's brilliant. It's been really, really interesting today, Jackie. Is there anything else you'd like to tell us that I maybe haven't thought to ask you about because I don't know?
You're the perfect example because you've had all the treatments.
Yeah, exactly. And I know how much it's helped me with every, I've had treatment for arthritis, especially on my hands where I had a lot of pain, and that's so much better after laser treatment. I'll probably do another one soon. And also when I did my tendon, that was, that helped me enormously. But also to see Pi, who's now nearly 14 and quite a heavy set collie, and quite a lot of arthritis, whenever he's had a treatment, he's always so much better. Again, because of lockdown, he's a bit overdue at the moment. But, I've just seen the benefits of what you've done.
I'm still amazed, even to this day, after doing it so long. I'm amazed at how well the dogs and horses and even people respond when they have arthritis. And I'm really bad at lasering myself, because if I do it all day, it's like anyone, isn't it? Cobbler and the children's shoes. I don't bother to laser myself, but I think I've lasered myself from top to toe while we've been in lockdown.
So you're a good advert at the minute.
Yeah, so no, it's quite nice because I'm actually getting lasered for once, which I don't usually. So, yeah.
Excellent. Oh, well, brilliant. Thank you so much for talking to me. And I'm sure and hope lots of people will be contacting you. Certainly by the time we come out of lockdown, I'm sure I will certainly be charging down to Southend if you're not up this way. So, but thanks for talking to me today. I'm just going to stop this recording and stop.